Welcome back to In Focus tonight here on Newzroom Afrika, Channel 405. Treatment Action Campaign has ushered in new leadership 24 years after it was established. The NGO says the move will ensure access to medicine and primary health care. It maintains much more still needs to be done to ensure that Section 27 of the Constitution is realized. Incoming chairperson Sibongile Tshabalala joins us now to share the vision for Treatment Action Campaign going forward. Sibongile, good evening. Congratulations for your re-election and coming back in as the chair of the Treatment Action Campaign. What is the role of the Treatment Action Campaign today, right? Looking at how it has evolved over the years.
Good evening, Thabo, and the listeners, and thank you for having me in today. Looking at the role of Treatment Action Campaign at recent times, or in these times that we are living in, Treatment Action Campaign is playing a huge role in making sure that we continue to advocate for better healthcare services in the country, as it was promised, and as our constitution of the country, Section 27, is saying that everyone has a right to quality healthcare services. But then we know that on the ground things are not happening well, and we continue to respond to those issues, advocate, and also raise issues where there is a need of better services. We are also concerned about the corruption that is continuing, especially in the healthcare sector. We are also concerned about the medical xenophobia that is continuing to happen, but also we are determined to continue doing a community-led monitoring with the project that give us exact data to be able for us to be able to engage the government and also talk about evidence-based issues that are happening on the ground.
So when you talk of community-led public sector clinic monitoring, what exactly are you talking about?
We are talking about engaging people who are accessing services in facilities. I'm talking about the Richitsa project that is widely known, and now it's recognized worldwide for its work that it's happening. This project, it's done by people living with HIV, 5 organizations, where we are monitoring the services on the ground. We are talking to healthcare workers, we are talking to patients, we are talking to communities, and also coming up with possible resolutions or recommendation where government needs to upscale their services, and also identifying the gaps where are they on the ground. So this project and community-led monitoring has taught us that with evidence that we have, we can be able to advocate better, and because we are giving accurate data to say we've spoken to how many people, we monitored this, how many clinics, and this is the response, and this is what is happening. There are pictures also that we are taking so that everyone can be able to see what is happening. But also what is important about our community-led monitoring is that we always have community accountability meetings where we invite the government from the district level to the national level to listen to people on the ground, listen to their stories, respond directly to them to say what are the issues and how are they going to resolve some of the issues that are raised by communities on the ground.
Yeah. Now, the reports seemingly suggesting that a lot of what you have focused on in your leadership really is the independence and the impact of the various branches that you have across the country. How are you reinforcing that work to be relevant to the kind of environment in which we are functioning at now?
Yeah, as much as it's not easy, but Treatment Action Campaign is very lucky to have a committed cadres on the ground in terms of branch leaders and branch members of TAC who continuously doing a lot of work on the ground, educating communities about the science of HIV. Now we are talking COVID We have learned a lot. We've done our research. We have engaged with institutions like MRC, VETS, RHI, and other institutes to teach us to say what is really COVID, how is it infected, how to treat it, how is it affects our immune system, and how does it affect also people living with HIV. So all that information that we are getting, we are taking it to the ground, and our committed branches are taking it to the communities so that communities can understand the science of healthcare, of health in terms of pandemics that are coming in, but also not forgetting that HIV is still the problem. We are still seeing people dying of HIV. In South Africa, we still have about 3 million of people who are not on treatment, which means those people's lives are at risk. So we still need to continue to advocate for them to access better healthcare services, but also we still see more people we are losing to on follow-up, and that is a very much concern to us, because we expect everyone now to be on ARVs and no one should die of HIV, but we still have numbers or hundreds of numbers of people who are still dying with HIV. So that means our work is still needed on the ground. Hence, we continue to do that. So our branches are doing marvelous work, and they continue to visit school, clinics, and communities, engaging and educating communities. So that's how we are strengthening our branches and making sure that they are alive.
Looking forward, I mean, you've recently jumped into the fray in the what you call medical xenophobia in the matter of the MEC for health in Limpopo, and you've raised some issues sharply with the health minister. But going forward, do you think the kind of activism that you've come to be known for would still be relevant and still be applicable and yielding the kind of results that you want? Or is it time for activists to change their tact? You know, like a protest, for example, still effective in raising those issues?
They are still effective, but then as treatment action campaign, we have learned that go protesting or marching to the streets, mobilizing thousands of people and singing around the streets, as much as it raises awareness of what is happening on the ground. But also we have seen it as sometimes a wasteful expenditure, because we will mobilize 14,000 people, we fill the streets of Johannesburg or of Cape Town, we hand over a memorandum, and we expect a response in the next 14 days or 21 days, and the department or the government side, they will take their time to respond, and few people will go to that meeting and hear the response, and sometimes messages are not going back to the people on the ground. So we have adopted a new strategy where we are only talking to the government using our phones. We are in contact. We are tired of writing emails, because sometimes they don't even respond to those emails. We just text them, WhatsApp them, and tell them that in this area there is a problem and we need you to come and sort it out. But if we are not listened to, we are not just going to march and mobilize people and hand over memorandum. Our new strategy is that if they don't listen to us, we march, we go to offices, we occupy those offices, we sit there until they respond to our issues on the ground, because that's the only language that the government is hearing. So time for handing memorandums and waiting for 14 days, it's over. If they are not listening to us, if they don't want to engage us around the table, we'll go and occupy their offices until they hear us and answer us and give us the right answers that we want and do what we want to do. We need them to do as government leaders.
Yeah. The organization has given you another mandate to expressing confidence clearly in your leadership and what you are able to do. What have you promised them? What should we hold you to account on in your term now in office that you will deliver? Give us one or two things that you've committed to say, this is what I will deliver in this administration.
First things first, for me, I'm going to continue to work hard in terms of serving people of South Africa, especially those who are using a public healthcare sector, knowing that people are still struggling, but also fighting injustices that is happening and calling out those who are xenophobic, especially to Africans, because we are all Africans. There's no need for us to fight against each other or to chase other people away because of somebody else's wrongdoings. But also my other mandate is to make sure that I mentor the second layer of leadership, especially of women and young women, to the organization to be able to raise their issues and stand up for what they believe in as women, and also be recognized within the organization and externally out of the organization, because as women we have to prove ourselves twice than men in the space of activism and in leadership in every way and in every space. So I want to continue to stand up for the rights of women, and unapologetically so, and continue also to mentor young women to be skilled and be strong and be able to raise their own issues. Even if I have to do that alone, I'm prepared to do so, so that the women leadership be recognized within TAC and also in the civil society space.
Sibongile Tshabalala, appreciate your time. Thank you so much for coming on tonight here on In Focus, the newly re-elected National Chairperson of Treatment Action Campaign, Sibongile Tshabalala.